Tobias. I'm from Berlin, Germany, and I'm coming from medicine, studied health economics, and did a lot of great projects in especially Europe, for example, build up the e-prescription solution and so on. And today I present the smallest treatment room of the world. What it means. This is a room, we combine telemedicine, we combine diagnostic based on AI, and for example, the patient can make a treatment, and then he goes to the box. He goes in, then there's a lot of diagnostic, for example, vitals, or with blood, or ECG, or others. Then you sit down, and on the screen you see the doctor, and they can have a consultation, and they can talk about, and afterwards you get your prescription, or you make a decision to go to the hospital or to the doctor house. Where can the box be? The box can be everywhere in the place, wherever you want. It means, for example, in Germany now we roll out it in supermarket, in pharmacies, in malls, in front of hospitals, for example, to do the pre-operation and after components. What is in the box? You see a really box, it's live. There was a development of 3 years, and last year we started to do the rollout, especially now in Germany and Europe. You see a lot of telemedicine, working station, you have a freeze, and you have everything in what you need for consultation and treatment. And it's like a platform. That means you can integrate everything, whatever you want in the box. You can make it in a big size and double size. It's a large box and a small size. You can integrate ECG or others. It's working like a platform, even like interfaces. Sometimes, in some special cases, there's a nurse in there or someone from the pharmacy helping the patient, for example, to do the blood analysis and so on. How is it working in the business model? It's very easy, of course. We sell the box. It's producing in Europe. But if the patient goes in there, especially in Europe and in other countries, it's free. The insurance or the health regulation are paying for it. And the doctors get the monies, and we take just €2 as a fee from every consultation. So, for example, now we are signing in 2 weeks the contracts for 2,000 supermarkets in Germany and in Europe. And if you do 50 consultations, you can count what is the recurrent revenue. And we started development in a team, as a founder team. It was a medical expert, it was a lawyer, it was a furniture expert, and of course an IT and AI specialist, because there's a lot of technology in it, of course, for data privacy. And for example, if you go in the box as a patient, you sit down, you watch in the camera, and you get your blood pressure, you get your heart rate, you get your stress factor, and so on. And that's all AI-based technology. And it's now running and starting in Germany and Europe, and now we are starting to follow the calls from all over the world, especially from Dubai and this region here, and from US. And I show you, for example, one study from the market in the US. It's from Walgreens. They are now did a study to how can you integrate the box into the mall and into the supermarket and as a retail factory. And that's the reason why we are here. We are now searching for the investment to scale it up, to get it all over the world, because wherever you want, you can put on the box and bring the doctor and the treatment to this place without sitting in a plane or driving a car or whatever it's need. So thank you very much. Time's up.
May I
Here we go.
Of course. Thank you so much. Just a question that is a big question. I think I didn't understand what you're selling. I mean, it looks like, it's like a room with a camera. What about ECG and so on? So like, if I'm the customer, I do find the ECG in the room. And then the other fact is that you said it is a treatment room. It looked like more a diagnostic one. So what is in the fridge? And also, what about competition? Because I've seen several startups doing pretty the same, even from Germany. So please tell me more.
Yeah, of course, first it's a diagnostic room. You can go in and you was guided through it. You sit down, you look in the camera. First you get your vitals, of course, and then the doctor appears and he can guide you and say, I open the space number 7. Please take the ECG. For example, there's a good device for a six-channel ECG. You can put it on and I saw the pictures, for example. So first, of course, it's a lot of diagnosis. Then they talk and they can decide what about the treatment. Even you get a prescription, please go to the pharmacy and get your medication or your follow-up prescription, or, oh, it's urgency, please go to the hospital, I will call them, and then you can do a treatment there. So it's even like a screening. That's what we now often do in Germany or in Europe, that they in front of the hospitals on different places. You don't have to go to the emergency room as a not urgent patient, so you go to the box and then you decide, oh, it's urgent, go to the hospital, or it's not urgent, please come back on Monday or Tuesday or whatever. And the freezes, for example, for vacation and for influenza and in the COVID times.
I didn't understand. Okay, so for example, the supermarkets bought the box, the office. The doctors, how are they recruited? Is it you or offering the service?
No.
How does it work?
Yeah, good question. First, we work together with some companies who had doctors, for example, in doctor houses or in hospitals, with big hospital groups, for example. And we integrate first the regional doctors and talk with them, and if they have not enough resources or you need a special expert from wherever over the world, then you make an appointment further on. So that's how it works, and it's quite good.
I actually have a quick question.
Yeah.
I cannot trust myself to take my own tests or take my own ECG. So does the room come with like HTs, health technicians, or how to go about it? Like I would freak out.
Yeah.
As soon as the doctor goes, draw your own blood, and I'm on the floor.
Yeah.
So.
Yeah. It's for example, for a patient, often we use for like the diabetes. Maybe you know it. You make a small pitch and then you put it on a stripe, for example. If not, it's okay. That's the reason why, for example, in pharmacies or near hospitals, there's a nurse included at some times at the day, and of course they can get all the blood and whatever. And if you have a 12-channel ECG or something like that, you need assistance. That's clearly. But then the reimbursement for the doctor is higher, so it's a very nice business case, even for the doctor and the doctor houses and the hospitals.